Hey, how y'all doing today, man? It's your boy Nurse Akeem. Welcome back. I know I ain't posted in a while. I've been going back to school, but it's okay. I'm finna start like getting active in this thing, man. I kind of had a spark of breath fast, so hey, let's get back. I want to talk about the future of AI. Me being a site nurse, I would love to see how the future of AI will unfold in my profession. Anyway, let's get to it.
You could see a robot or two during your next visit to the hospital or the doctor's office.
One company has deployed what it is thought to be the world's first fully robotic medical assistant. Fox's Evan Brown has the details.
We've heard a lot about the robot
I can tell y'all right now, I work in psych. Do y'all actually think this is gonna work?
revolution lately, and now our automated friends are seeing more action than ever thanks to AI programming. That's prompted a push for robots in the medical field, but so far they've been used for things like transcription and disinfecting. Now one company, Enchanted Tools, has gone a step further, deploying a robotic medical assistant called Miroki. The developers say it arose out of a lack of trained medical personnel.
What we see is
It'll work out of the lack of train. Man, come on, that's a load of crap, man. What it is, y'all don't want to pay nobody, man. Like, I get this.
that we need more nurses, we need more caregiver to bring them a superb tools, something that help them to increase their productivity.
Miroki
So, I know one way we can get more nurses in there. How about you pay them more? You know, and I don't know where y'all at. I live in Georgia, but I go down to Florida because Florida actually a little bit better. What people looking at 3% raises, man? If you make $30, about $30 in Florida, give or take, from Florida all the way up to when you start getting into Macon area, then you start seeing like a 35. Man, I was looking on the internet the other day, man. Emory University, like $40. Man, y'all tripping, bro.
isn't designed to replace your doctor or your nurse, but it can make their jobs easier by taking on some of the logistical tasks and patient interaction. And it was designed to put patients at ease with a fox-like appearance.
Come on, who would feel comfortable with this around them, man? And definitely not in the hospital, bro. Like, can you imagine somebody manic, right? They in one of their manic modes, and they see this damn thing, man. You think hiring nurses costs? If you keep breaking these
And a character backstory.
It comes with a kind of psychological effect that we need to take in account when we are designing such machines. So that's why that was very important for me to start from scratch.
And they're already being deployed at a hospital in Montpellier, France, where they're doing everything from carrying supplies to offering.
Yo, I ain't even gonna lie myself, man. If I walk this past this thing, man, how friendly do you actually think I'm gonna be to this thing, man? These, I guarantee you, they may be cheap in France, and excuse my French, but I can guarantee you one of these things in America gonna cost about $250,000. I guarantee you. And $250,000, right? Let's just say 100,000 in Florida, 100,000. That's 2.5 nurses right there. But they looking at that what they looking at is that's a one-time thing. We don't have to train it. So let me get this straight. Well, it probably would pass the NCLEX if you put the robot in there. Let it. Duh, because it's connected to the internet, it can give you can connect it to Chat GPT, and the damn thing probably. But that just like in human being, just because you pass the NCLEX don't make you a competent nurse on day one. You still have to learn people. You have to understand people. These robots don't understand people. They only understand what they have been programmed to do. And just imagine if you put these things in L&D delivery. So I just saw something earlier about something in the news about labor and delivery. It was a black girl, and she was pregnant. I think she had the baby like maybe 12 minutes later or something after she was in there. But if racist people program this damn thing, what do you think gonna happen?
Bring emotional support for child cancer patients.
Of course, kids are like, wow, a robot. But it's not only kids.
The medical robotics industry is worth about $16 billion, and that is expected to double over the next 5 years. In Miami, Eben Brown, Fox News.
Still ahead.
Come on, man, give me a freaking break, yo. And then you see how they throw that in there at the end. They always up riding kids' asses, trying to get kids on the bandwagon. I remember growing up in the early 2000s, but I was born in '89. But I remember vividly being in the 4th and 5th grade, how they push computers on us. If you like 36, I know anywhere from 36, 35, all the way on up to maybe 50, you should be pretty damn cool with computers at this point. But look at AI. They pushing AI on people right now. When these I got a 12-year-old, and even on my 3-year-old. When my 3-year-old get to be 17 years old, AI will be completely normal to her. You know what I mean? And she would be so receptive to the fact of having AI as a healthcare worker. But I could never understand it, because you can't change. You can't program the human spirit. You can't program the human spirit to live. Sometimes people just need words of encouragement. They want to feel like someone loves them. A computer can't love you. It can't even emulate love. Love can't be programmed into nobody, you know. So, in my opinion, is AI going to take over? It might take over in the sense of administrative duty. Like, go get me some of this, go get me some of that. But the compassion, they could never replace that. And I work in psych, so psych is a very compassionate field. You have to really, really like that. A lot of people are starting to get into psych because, well, really they ain't getting into psych. They skipping the psych part and going straight into nurse practitioner school, which that's a whole nother subject. I ain't even gonna talk about that right now. But my name is Nurse Akeem. Get down in the comments and let me know, do you think AI is going to take over healthcare? Hey, it's been my pleasure dealing with y'all today. I was working on another video, but I said, let me take a monotonous break and do me one of these. And I'll be trying to push these type videos out like at least 3 times a week from here on out. Hopefully I start getting some nice reception. Until then, y'all, peace, love.